Welcome everybody to the Wake Up Call channel. This is one of the funniest clips I think I've ever seen produced by the mainstream media, if you want to call it that. You have to be in a pretty deep psychosis to believe anything that you hear on the news anymore. But this is one of the most laughable clips you could possibly imagine. So supposedly, we have a new strain again, kind of like this is the new narrative, right? New strains, new mutations of the bird flu. Again, a flu that is only specifically for birds that now everybody can supposedly get. And a man has died. A man in Mexico has died from this. You have to listen to this news report I'm about to play for you. The man has died, but nobody thinks that he actually came in contact with any poultry or cattle. So the guy comes on the air and he goes, well, we believe that he came in contact with 30 people, 17 people maybe at the hospital, including a man who may have had a runny nose. And then there were 12 contacts by his home, but nobody knows who's symptomatic or who isn't symptomatic because we don't know what symptomatic means. Huh? This news clip should be put in a museum for how to produce fake news propaganda. Listen to this clip and try your hardest not to laugh.
And good evening. We are following a lot of breaking news tonight as we come on the air. We want to start with a strain of the bird flu never detected in humans before. It's now being blamed for the death of a man in Mexico. Here's what we know right now. A 59-year-old man died back on April 24th. The World Health Organization says he died after contracting the H5N2 strain of the virus. But they aren't exactly sure because he had no previous exposure to poultry or to other animals. They're not sure how he got it. His death came a week after developing a fever, shortness of breath, diarrhea, and nausea. The organization adding he did suffer from underlying health issues. The announcement comes as an outbreak of a different and more common strain of the bird flu was detected in a number of dairy cows in the U.S. There have also been at least 3 human cases tied to the H5N1 strain right here in the U.S., all connected to farm workers. These are the symptoms for the avian flu strain currently circulating around the U.S. It includes fever, sore throat, eye redness, among other symptoms similar to colds. There are a number of questions tonight, including if this new strain has made its way into the U.S. Ahead, we speak with a doctor about the risks. But first, we want to start with NBC News correspondent Sam Brock, who joins us tonight from Miami. So, Sam, talk to us about this case that we know out of Mexico that we're covering tonight. You know, the weird thing is here is that he was not in any contact with any livestock or poultry, so they're not sure how he got it. Do we know if he was in contact with lots of other people?
A decent number of people, Tom. And so the World Health Organization says this 59-year-old had about 30 contacts. 17 of them were at the hospital. One of those people reported having a runny nose. But, Tom, not one of them tested positive for this strain of the avian flu. Now, here's what's interesting. There were 12 other contacts near that man's house. They said that 7 of those people were symptomatic, 5 asymptomatic. It's not clear exactly what symptomatic means. But, again, none of them tested positive either. Now, were the 7 symptomatic at one point contracting a strain of this virus, but it just didn't affect them the same way, and they didn't test positive by the time the testing actually proceeded, or did they never get it at all? Not clear. But among almost 3 dozen contacts so far, this man is the only one to actually test positive for this strain, H5N1.
So again, you can see where this is going, right? I mean, you came in contact with somebody. The way that the guy even says it, he's like, he came in contact with somebody who had a runny nose. Somebody who had a runny nose. But there was 30 contacts, 17 at the hospital, 12 by his home. I mean, we can see where this is headed, right? Where this is headed with some people have come in contact with birds and birds and cattle. Some people haven't, but they came in contact with one another, and it might have been your next door neighbor. So your next door neighbor might have went to a cattle farm, or listen to where this news clip progresses to. Because it progresses to the point where they're starting to warn people because it's summertime and people go to fairs, county fairs, and there's cows and chickens there. They're already warning people about going to fairs because if you go to a fair, you might get the bird flu. Now they say, of course, because they don't really want to scare you, but of course that's exactly what they're doing. They tell you, 1, stay away from any raw milk because, again, they don't want you having raw milk. There's this huge wave of people waking up to the pasteurization of milk and how it's not really good for you and how raw milk is actually good for you. And I talked about that in a previous video with even how the Rothschilds spoke in Parliament. And one of the things they spoke about was making sure that all milk was pasteurized, and this is bad for people's immune systems. And secondly, when they talk in this clip, they're like, well, don't worry about going to a fair. You know, we don't want you to stay home and not go to the fair. Just stay away from birds and cattle who are sick. They don't tell you, of course, how would you identify a bird or a cow that is sick? They're pretty much hinting at people, don't eat meat, don't eat chicken, because they don't know if the chicken or the bird or the whatever is actually sick or not. So just be extra cautious. In fact, why don't you just lock yourself in your home this summer? Don't even think about going outdoors. Listen to where this clip ends up going.
The biggest thing to do is to stay away from sick animals. And we know that this virus could appear in raw milk. The forced pasteurized, and hence always drink pasteurized milk and avoid raw milk. Those are some of the basic things that you can do to avoid that particular outbreak that's going on. Now, the concerning thing is summer is coming, and then you are going to have, farm fairs, right? Agricultural fairs, people may be interacting with cattle. So one other thing I want to add to my earlier answer is if you're going to those cattle fairs or other places where you might be interacting with both barnyard animals and, of course, poultry, just be careful. Stay away from sick animals. Always sanitize your hands.
State fairs can always be so big in the summer.
So we can see how that type of psychosis will work on people out there, right? They do this in a way where they don't need to tell you flat out not to go to a fair, but there's so many people out there that'll hear these types of things that they won't even go within 100 yards, not 100 yards, let's just say they won't even go within a mile. They'll probably be driving down the highway and see a farm coming up, put their mask on in their car because they'll be afraid that the cow might fart and they may get the bird flu. I mean, just the fact that we're at the point now with the bird flu where we're talking about human beings dying from the bird flu, the media telling you, well, where's this going? All these mutated strands of it. And there's many people out there that see this and they're actually fearful of the bird flu instead of seeing where this is going with the food supply chain. Instead of seeing where this is going with mandated vaccines on all birds and all cattle, all things that you eat, they're going to get this CRISPR into. So the story with this mysterious man who passed away, who they didn't give his name, just a man in Mexico. I would have to guess his name was George Glass or John Doe. It's one and the same. The story is that a person with prior health complications who had contracted bird flu died in Mexico, and the source of exposure to the virus was unknown, right? So keep that in mind. Unknown. How did he get it? He wasn't near birds, and he wasn't near cattle. I mean, there was even a part of that interview on NBC Nightly News where they start talking about, could you pet a pigeon? I mean, he even goes into detail about, like, where would you get the bird flu? I don't really go around birds, but should I be afraid to go outside because there could be a bird flying around? And they're literally starting to push that type of propaganda. Well, you better be careful if a bird shows up in your backyard and lands on your tree. It could be a sick bird. I mean, there's so many different kinds of birds. And people out there hear this stuff. And again, it works psychologically on them. And we can look at it and laugh and say, who falls for this? But how many people did you see when you were driving down any road? If you were on a highway, you definitely pass somebody wearing a mask. You still see people. I go out here and there to a store, and I still see people wearing masks, and I just shake my head and I laugh, right? Looking at them in the eyes. And they don't even have a clue what I'm laughing at. They think I'm just laughing at, something in my head. Right? They don't even realize that the joke's on them. So the WHO said the current risk of the virus to the general population is low. Keep that in mind, though, because they're really pushing this more towards getting this into the food supply, getting this into chickens, and chickens will transfer this to the eggs. This is all stuff that we eat. It's another way to get this transmitted into our bodies. So the 59-year-old resident of the state of Mexico had been hospitalized in Mexico City. He died in late April after developing, as you heard, a fever, shortness of breath, diarrhea, nausea, and general discomfort. And of course, as you heard the guy say, came in contact with somebody who had a runny nose. I can't believe it. The way the guy said that with the runny nose, I mean, I was on the ground. Although the source of exposure to the virus in this case is currently unknown, the viruses have been reported in poultry in Mexico. It was the first laboratory-confirmed human case of infection with an influenza virus globally, and the first avian H5 virus reported in a person in Mexico. Scientists said the case is unrelated to the outbreak of H5N1 bird flu in the U.S., that has so far infected 3 dairy farm workers. So the more they condition you with these stories, the more people just accept this narrative that these mutations of these diseases exist, right? Oh, there's a different variant of the bird flu in Mexico than in the US. And then there's another mutated version that they've never seen before. And then another and another and another, right? It was amazing when people started accepting all the variants that they were trying to push a couple of years ago, the Delta variant. I mean, remember every month there was a variant that came out, and it started becoming laughable that you saw them actually take their foot off the pedal because they weren't convincing more people to be afraid, right? Well, now they're really just staring right at our food supply and saying, okay, these people who, refuse to get it are obviously people who are going to eat chicken, who are going to eat cattle, and we can transfer it with CRISPR. That's literally what they're trying to do. So Mexico's health ministry also said in a statement, the source of infection has not been identified. The victim had no history of exposure to poultry or other animals, but had multiple underlying medical conditions and had been bedridden for 3 weeks for other reasons prior to the onset of acute symptoms, right? So we're just going to diagnose people with the bird flu. They can't even tell you what symptomatic means. I mean, they flat out tell you, and then it's like, well, they might have been, these people, 12 people were symptomatic, but we don't know what symptomatic even means, right? So in other words, this guy could have had pneumonia for all we know, and then they're telling us that he has the bird flu. It sounds a lot like something that just happened when people had literally runny noses and coughs, what was called the common cold a year prior. Suddenly everybody was being told that it was something else, and then we had 0 cases of the flu. I mean, it's absolutely incredible that we let them get away with this type of stuff. But what's scarier is the fact that people believe it. And, people are going to be, in the summer, there's probably going to be signs. Like if you are somebody who goes to a county fair or you go somewhere where there's going to be people around cows or even if a rodeo, something along those lines, there's probably going to be signs up that say stay away from the sick cows. And then, again, one of the things that they're going to push is like, hey, these cows are just moving from place to place, so we can't monitor or track where this cow came from because I guess cows just get bought and sold day in and day out. So this cow came from this ranch, it got moved to that ranch. So then every cow in that ranch is all right, the best way to just resolve this is to get every single chicken and cow to get this potion inside of it. And then when the human being eats that meat or that egg, well, then they'll get it too. We just won't tell any of them. So that's the story that's out there. Literally, I mean, you can't make this stuff up. You can't make it up. Share this video with people. I mean, is it just me? Let me know in the comment section. Breaking news, man dies of bird flu was laughable enough, but where that story started to go with coming in contact with somebody with a runny nose may have been how he got it because he didn't come in contact with the chicken. I mean, 30 contacts here, 17 contacts there, 10 people walked by his home who may have been near a chicken. So, I mean, you could see where this is going with social distancing and why they're going to start using just talking like that, right? Confusion talking, naming how many people came near this guy's home, how many people walked by this guy. Oh, we need to monitor that so we can keep the disease under control. Well, the only way to monitor that is with a carbon footprint or some type of tracking so we could track every movement of every person, like a digital ID, right? And that's where that was going. That's what they were subtly telling you. How would you know? You're in your home right now. 15 people walk by the outside of your home. Would you have a clue? No, you wouldn't have a clue, right? Would you? I mean, if you live in an apartment building, how many people walk by your door? You don't probably know. Okay, well, they want to know. It's important for them to know so that they can protect you from getting a flu for birds and getting a runny nose. And people go, oh, okay, that makes sense. The WHO wants, that pandemic treaty they're talking about, they want to make sure that we're all healthy. Oh, is that what it is? And they want to monitor how many people walk outside your house. That way, then we can monitor the people who walked outside your home, and then we could track where they've been every single day for the last month. Oh, and this person went to a dairy farm 3 weeks ago. Oh, okay, now we could track that dairy farm. Now we can track every single person who was at that dairy farm and every place they went and every person they came in contact with. And let's quarantine all of them because quietly while all this has been happening, we've been passing bills and laws that say that the government could come in and quarantine people without any persecution, without any pushback, that you don't have any say in it, right? In a lot of these lib states. Oh, well, it's for the betterment of you. Somebody came outside your door who 3 weeks ago was at a poultry farm in another state, so we're going to put you in a quarantine camp, even though you were inside and never came in. And everyone's just going to go, okay, well, it protects me. Because if that person's out in public, I might be at the grocery store, he might be sick, so I might get sick, and then my head might just explode. That's the point. Giving them control with technology to track and monitor everything, and people are going to think it's for their health benefit. It's unbelievable. I thank everybody for being here. Hope you're all doing well. God bless you as always, and your families.